Well, I had, first of all, a good role model. My father also was an orthopedic surgeon, saw the satisfaction he got out of practicing medicine and followed him around enough to say this is something that I wanted. Now, I didn't always know I wanted to be an orthopedic surgeon. That was something, a decision I made during medical school. The light bulb moment actually was a lecture by a pediatric orthopedic surgeon who was presenting their electronic computerized knee brace designed for kids with Duchenne muscular dystrophy. I looked at what he was doing, and how he was going about it, and of course the computers weren't anywhere near as powerful back then as they are now. And I said, why don't you just do this mechanically? And he challenged me. He said, well, why don't you do it? And I said, I can. And on the orthopedic rotation in medical school, I saw two things. I saw one is something I enjoy doing, and two, something that I could be good at. And my decision was made after that lecture. I think that there are two different things that I bring to the table that you don't find in many, if any, other places. And number one is it's been my goal from day one to take care of each patient as if they were part of my family. In these days, there's a lot of pressure on doctors to become assembly lines. And I refuse to do that. I don't want to be treated as an assembly line patient, just rushing down the way and get my 5 or 10 minutes with the doc and then he's off someplace else. Decided very early on that I was going to be sure that I gave each patient the time that they needed to take care of their problems, their questions, and be sure that the treatment fit them. Not my schedule, not the x-ray, but it fit the patient. That's number one. Around about 2003, I started getting involved with less invasive hip surgery and subsequently less invasive knee surgery. And the rapidity with which these patients recovered was just dramatic. And so I've been developing the techniques and instruments, one of which has a patent, by the way, for less invasive hip and knee surgery since 2003 and 2004. When I'm meeting a new patient or a returning patient, I think one of the most important things that I do is try to figure out where that patient is and how much the problem that brings them to see me affects their life. And so I'll ask a lot of questions about it and try to get an idea about how much impairment they have from the problem that brings them to see me. Every patient should know that when I'm in their room, they have 100% of my attention, and I'm not going to be rushing off to see the people to follow.